when that occurs, look what happens. You can definitely see this impinging nerves. Well, no wonder that you're having the headaches and you're having the problems that you're having. And when we look at the very top cervical, right here's the base of the skull, and here's the first vertebrae. When we're looking at this, we can definitely see that this first bone right here has shifted. As it shifted, it's pinching the nerve. Well, guess where that nerve goes? Up into the head. So it goes up into the head. It's creating those headaches that you're having. It's creating the migraines that you're having. So we've got to get that area corrected. Not just temporarily put a Band-Aid on it. We want to get everything moving in the right position so that we can take the pressure off, so that one, you can not only get rid of these headaches and this neck pain, but that the nerve flow from the brain into the rest of the head can occur, and hopefully some of those allergies, symptoms are going to go away. You won't have quite the sinus problems that you're experiencing. When we look at this other view and we look further down into the neck, you can definitely see here, this is in the lower part of the neck, there's again some rotation. Well, that's coming out, those nerves come out, and those are the ones that ultimately go down the arms. You're not experiencing arm pain now, however, and I hope you never do, but you are experiencing pain going out into this upper trap, that's what we call it, the upper trapezius, out into not quite the shoulder joint, but into here, and that's because this nerve is being pinched. So again, we have to move that vertebrae back in the right position so that we can stop some of that deterioration, but more importantly, or just as important I should say, is we can cause the nerve, the flow from the brain to be able to come down the spinal cord, out the spinal nerve, and go into all the areas that it needs to go into. Now, you'll notice too that because I told you were between the second and third deteriorative position, if we look over here on this back part here, let me have that just a minute. Good. We look on this back part here into the x-ray part of some examples, we can definitely see where, I told you between the second and this third one. Well, you can see what will happen if it continues to deteriorate. Okay, so you're going to be able to take this handout home. It's going to have that paper copy of your x-rays where I've got all the numbers on it, the circles, you saw where I put the lot circle around your degenerative disc area, and where everything's misaligned. And that way you can go home and you can show your husband exactly what's going on, what's happening, and can explain it to him, but they can also get him into the class that we're going to talk about in a few moments, where we go into some great educational information. I think that's a great idea for him to attend with you. That way what happens is he can really see where you're headed to, where your chiropractic care is going to. So let's talk about the solution. All right, what is the solution to what's going on in your body? Well, the solution is, of course, the adjustments. So when you're being adjusted, we're trying to get the spine into the proper alignment. And that's what I was talking about and showing you as we were talking about your x-rays. Getting everything in the right position, getting those vertebrae moved is going to take the pressure off the nerves so that you can, have less pain, but also can heal and can have less of chances of having some disease processes that happen there. So there are three things that's going to happen. First is the getting your body back to as 100% capacity as it can so that it can heal. And the other thing is if you look right here, removing the nerve interference so that we can prevent future sickness and disease and pain. The next step is going to be future performance. We want to get you back to as great a mobility, and we want to do that for your entire life. And if we can do that for your entire life, then what's going to happen is if you look here at, again, I like to point back at the model here. When you look back at the model here, you'll see that we've talked about being here. Well, I want to prevent you from getting to this point. So, again, you have to think about in terms of, at this moment, what's going to happen? Well, there's going to be a series of adjustments. And those adjustments are going to occur in a couple of different phases. So, because we have to retrain your body to, am I trying to say? So you retrain your body to leave the vertebrae where we want them to be, because what happens over time is your body gets accustomed to the position that your vertebrae are in. And when that happens, it wants to stay that way. So the first phase of care we have to do is really pain relief. And I know that's, what's most on your mind right now. And that's an important phase. But the second phase is stabilization. We've got to get you to stabilize. And, you're very fragile at this point as far as, your vertebrae is concerned, because they don't want to get in the right position and stay in the right position. So what happens at probably about the sixth visit or so, if all goes according to the way I'm planning and your body reactions, we will start a series of exercises for you. And those exercises are called rehab. And so what it does is it helps to strengthen the muscles along the spine. So if we look here, we'll see the muscles along the spine, in the front part and the back part, have to become stable. And if we can stabilize these muscles along this area, what happens is over time, the body will start to leave these vertebrae where it needs to be. So we have to make sure that it's stable. And so what happens is typically, instead of, initially starting you off at 3 times a week, what we're going to do then is, when we move into the stabilization phase, is we'll go from 3 times a week to twice a week to once a week. And so if we can go faster, we're going to go faster. If I need to slow down, we'll slow down. It just depends on how well your body responds to the care. Because depending on, if you continue to do the things that you're doing, I know your job requires you standing all day. It requires you kind of looking down on the line, using your arms a lot. And so what's going to happen is your care could very well take a little bit longer, or your body could respond very well and, it start leaving those vertebrae in the right position. If it starts to leave those vertebrae in the right position, then, I'll be the first to admit, hey, I think that we can really move along a little bit faster than we had anticipated and get you to the point where you're doing exercises a little sooner than we had first anticipated. Now, so let's think in terms of, we get rid of the pain, we start to stabilize those vertebrae. Now we have to go into the wellness stage. So the wellness stage is as important as getting rid of the pain and stabilizing the vertebrae. So what we have to do is stop what's causing the degeneration that's there. And the only way to do that is through regular preventative wellness care once we get you through those first 2 phases. And those first 2 phases typically take about 20 visits. Now, again, it could take a little less, it could take a little more. It really just depends on how well your body responds. So we want to stop the wear and tear in the body, and that's how we do it, through getting you into a wellness point. So that wellness point is typically once a month. And what that does is, it's like if you went to the dentist, and the dentist would never tell you, well, all right, we got them clean today, and don't come back again until your teeth are hurting. Yeah, you chuckle. So everybody does. So what happens is that you're already at a critical point again. If you have a cavity and it's hurting, you don't want him just to Bondo it or stick the filling in without cleaning it out first, and then you're going to want to keep checking it, because it could be spread a little bit more. It's the same thing with your spine. Once we get your spine aligned, we get it stabilized, and it's staying there for longer and longer periods of time, we have to keep it that way. And so we'll talk about that a little bit closer to that 20th visit, but that's a very important stage of your care. And that's one of the reasons I want your husband to come in, so that he can really see, not only are we trying to get rid of pain, but once that pain is gone, we need to stabilize. Once that stabilization occurs, you're still going to continue to come in, just less frequently. And I think once he understands that, and he sits in the class and he realizes that, he's going to be all on board, and hopefully we're going to be able to get him in and help him with his neck pain or back pain, whatever it is that he may be experiencing, or if he's not experiencing any pain at all, as we discussed, preventative. Being able to prevent any future disease is really important. So, what we're going to do now is we're going to, what I'm going to do is we're going to give you a ticket when you check out. And what that ticket is for you to attend our How to Stay Young class. That is so very important, and it's a very big beneficial part of your care, because it gives you and your spouse, your husband, the opportunity to get an even further in-depth information about chiropractic care. So we do our classes on Tuesdays at 12:15, and we do them on Thursdays at 6:15. Now, what time is going to be good for you to be able to get in here and get your adjustments? I want you to either come in on Monday, Tuesday, Thursdays, or Monday, Wednesday, Thursdays. I noticed that today you came in at about 5:30. So is that typically good for you, is 5:30s? So what, or 5:30, not 5:30, sorry. So what we're going to do then is we'll set you up for 5:30, and let's do Monday, Tuesday, and Thursday. And we'll set you up for this Thursday, that once you're finished with your adjustment, then you will stay in the class. We do it out in the waiting area, so you'll just go directly from your adjustment into the waiting area, so that we can get you in that class. If your husband would come with you that day, or if he just wants to meet you here at 6:15, that would be great. So I'm going to give you a ticket for you, and I'm going to give you a ticket for him when you're leaving out. But first, let's take a look at the back of this. Let's turn this over just a minute. Okay. So what I'm going to do is, in just a minute, I'm going to write down that you're going to plan on attending on that Thursday at 6:15. Sound good to you? Good. So, actually, let's write that down on here, that you're going to be attending this class on Thursday at 6:15. We've talked about what you're seeing here, and this is what I've listed as far as 3 times a week for 10 visits, and then 2 times a week and 1 time a week for 10 more visits, and then eventually the last stage here is getting you to once a month, and that's 1 time every 4 weeks. Sound good to you? Good. So, what is expected of you? Well, you're going to have set appointments, and that's definitely expected to keep those appointments, coming to the How to Stay Young class, doing your exercises. And then we're going to also have you attend this How to Stay Young class at 6:15 on this coming Thursday. So that date is the 30th. The 30th. So we're going to put that down here. The other thing that I wanted to talk to you a moment about is the fact that Sharon, the nurse practitioner, has made a couple of recommendations for you also that are going to help facilitate your chiropractic care. She has made the recommendation that you be able to take a TENS unit home with you, which is the electric muscle stim unit. So what happens is when I leave here, Angela, who's in charge of our insurance department, is going to come in and go over all of your insurance information with you. She's going to give you a cost of your care for those first 20 visits, and it's going to include a TENS unit, electric muscle stim unit. Have you ever had that before? Good. Now, sometimes if it was through a physical therapist office, it'll be a little different than through our office, and so one of the ladies in the therapy area, when we walk in there, is going to explain exactly how we want it to feel, how high we want it to go, and what it does is it helps decreases the spasms and helps some with the pain. It's not the correction. The chiropractic care is the correction. But it's a great way at home to be able to get some pain relief, help decrease the spasms in between your chiropractic care, or let's just say on the weekend you have a flare-up, you can use that to really help decrease some of the pain too before you get back in here on Monday morning. Because I prefer patients using that versus a Tylenol or an aspirin if they have some kind of problem. Okay? Perfect. So, let's get you to sign this form here. I'll give you a pen. And that's all of what we just talked about and we explained. Perfect. Now, see your half sitting over there. Have you already signed the consent to treat? Perfect. Do you have any questions about it? Good. So if you'll just give me that too, and we'll put this in your packet. I'm going to put your x-rays in this packet also, so that you'll be able to have those. And Angela's going to come in, and then I'm going to see you in just a few moments. All right, have a great one.